Hi, I am Igor, and today we will go talk about Behcet's disease. Definition: Behcet disease is a type of variable vessel vasculitis that most commonly affects young adults between 20 to 40 years of age from the Mediterranean region to Eastern Asia. Epidemiology: most common affects individuals from the Mediterranean region to Eastern Asia, which is higher prevalence observed in Turkey and Japan. Peak incidence between 20 to 40 years of age, more in men than women. Etiology: possible autoimmune and infection triggers, for example, precipitating a herpes simplex virus or parvovirus infection, strong HLA-B51 association. Pathophysiology: autoimmune systemic vasculitis that can involve arteries and veins of all sizes, characterized by the deposition of immune complexes, proliferation of CD4 T cell, and increased cytokines. Clinical features: recurrent painful oral aphthous ulcers, typical the initial presentation symptoms, usually last about 1 to 4 weeks. Recurrent genital ulceration, a single or multiple ulcers that resemble oral aphthous ulcers and heal with scarring. Most commonly affect the vulva and the scrotum. We see aphthous ulcer in patients uh, who in Behcet disease, oral ulcers. Ocular disease, uveitis, iridociclitis, chororetinitis, keratitis, and/or retinal vasculitis, typically bilateral. More common and severe among men, usually occur 2-3 years after the onset of oral and/or genital ulcers. Arthritis is non-erosive, non-deforming, asymmetric monoarthritis or oligoarthritis, usually affects the knees, ankles, hands, and/or wrists. Skin lesion, erythema nodosum, is nodular lesion, pyoderma gangrenosum, pseudofolliculitis, and acneiform eruption. Dermatography is formation of urticaria after minor pressure is applied to the skin, likely mediated by local histamine release. Positive pathogen skin test. The appearance of an erythematous papule or pustule 48 hours after a 5 mm skin prick with a 20-gauge needle, usually on the forearm. Gastrointestinal disease include abdominal pain, anorexia, diarrhea, low GI bleed, nausea, and vomiting. Vasculopathy includes superficial thrombophlebitis, thrombosis of large veins, for example, deep vein thrombosis, Budd-Chiari syndrome, arterial thrombosis, aneurysm, pulmonary artery aneurysm. Neuro-Behcet syndrome. Neuro-Behcet syndrome is parenchymal CNS disease. Symptoms include behavioral changes, ataxia, hemiparesis, sudden hearing loss, non-parenchymal CNS disease, cerebral venous thrombosis, and intracranial hypertension. I include a photo for these topics: is uveitis in patient disease, genital ulcers, and erythema nodosum, and also aphthous ulcers. And we see hypopen in patient with Behcet disease. Diagnosis. Diagnosis include one big criteria and additional criteria. Big criteria include recurrent more than 3 episodes with a 20 months period or oral aphthous ulcers. And additional criteria is recurrent genital ulceration, ocular manifestation, for example, uveitis, retinal vasculitis, cutaneous lesion, and positive pathogen test after 48 hours. A diagnosis may be established in patients who fulfill the mandatory criterion plus more than 2 of additional criteria. Laboratory studies is CBC, uh, com complete blood count, is leukocytosis, inflammatory markers is increased erythrocyte sedimentation rate and C-reactive peptide more than normal. Serology, autoantibodies, for example, antinuclear antibodies and anti-neutrophilic cytoplasmic antibodies and rheumatoid factor are usually absent. Genetic studies HLA-B51 testing is not routinely recommended. Treatment for ocular and CNS disease and also vasculopathy, systemic glucocorticoids sparing agent, for example, azathioprine, infliximab, cyclosporin A, cyclophosphamide, interferon alpha, and methotrexate. Mucocutaneous lesion. Topical glucocorticoids, for example, triamcinolone, can accelerate the healing of oral and genital ulcers. Immunomodulatory agent. Consider colchicine to prevent lesion recurrence. For arthritis, first line is colchicine. Thank you. Subscribe to the channel.